I'm Dr. Michael Belmonte, and I look forward to presenting my research on nursing attitudes towards abortion care, the impact of a values clarification session. My advisors for this project were Dr. Bernard, thank you for that introduction, and Dr. Carolyn Rouse. For those of you who may not be familiar, the concept of a values clarification was originally developed as a self-exploration technique in the 1960s. This technique allows a person to choose the underlying values that drive them, appreciate them or prize them, and then work towards aligning those thoughts and feelings with their actions. Interventions were then created from this technique and were first used in schools, but over time, these interventions were adapted to be used in different contexts. With abortion care as the context, values clarification sessions have been conducted nationally and internationally for many different audiences, including physicians, nurses, midwives, social workers, psychologists, other hospital staff, and even the general public. Unfortunately, these interventions have not been well documented or assessed, and therefore there is little published research in the area. The most well-known study comes from IPASS. It's an international organization focused on expanding access to safe abortion and contraception care. Their study was conducted across 12 countries and demonstrated improvements in knowledge and attitudes towards abortion care, as well as increased intention to participate in said care. There remains a gap when it comes to studying values clarification sessions among non-physicians within the United States, where mounting institutional and governmental restrictions severely limit access to abortion. Our research was intended to begin to fill the gap by evaluating the impact of a values clarification session on nurses' attitudes and participation in abortion care. We hypothesized that the values clarification sessions would lead nurses to feel more accepting of and comfortable with the provision of abortion care services, and in turn, be more willing to care for these patients. These sessions occurred at Indiana University Health's Methodist Hospital, which is recognized as level 4 in obstetric care and level 3 in neonatal intensive care here in Indianapolis. Nursing management at the hospital had reached out to us for assistance in planning and coordinating mandatory sessions for all of their labor and delivery nurses. The sessions were created to last about 2 hours, which included introductions, a brief educational portion, followed by the values clarification activities. The educational portion was given by an obstetric physician with experience in the management of complex maternal and fetal care and included information regarding abortion, such as common indications, medical and surgical methods, hospital, state, and federal policies and laws, as well as perinatal services available to those seeking abortions and their families. This ended with time for nurses to ask clarifying questions. Values clarification activities were then led by Dr. Lucia Woschel, the nurse ethicist at IU Health's Methodist Hospital, and was modeled after the one described in the Abortion Attitude Transformation Toolkit from IPASS. 5 sessions were held between August 30th and September 23rd, 2019, and were offered at various times to accommodate nursing schedules. 97 nurses were employed on labor and delivery during this time and were all invited to the sessions with a maximum of 20 nurses per session to facilitate dialogue. While attendance was mandatory, survey completion was completely voluntary. If nurses desired to participate, they were given a pre-survey to be completed prior to the session, as well as a post-survey to be completed after the session. Nurses self-selected ID codes to link their surveys together without concern for study personnel or hospital staff having access to their linked identities. Survey questions included general beliefs about abortion, beliefs about availability of abortion, and current comfort and experience with providing abortion care. Barriers to providing care were also asked about. All questions were modeled after previous studies, but edited to fit the needs of the specific group. Of note, all questions had a skip option in order to ensure nurses did not feel pressured to answer any question that they did not feel comfortable responding to. Surveys were then collected anonymously, and the data was not aggregated until after the completion of all sessions. And of course, the IU's Institutional Review Board approved this study. While a total of 97 nurses were employed and invited to the session, only 89 attended. These 8 nurses did not participate in the session due to scheduling issues. Of those nurses that did attend, 60 consented to participation in the study, and 49 completed at least a portion of the surveys. Here you can see an overview of the characteristics of study participants. Of note, category percentages displayed do not add up to 100%, as some of the data was missing. The group of nurses studied was fairly homogeneous, with an average age of 35.7 years. 91.8 self-identified as female and 79.6% as white. A majority of nurses identified as a religious affiliation with a branch of Christianity, 63.2% in total, while the remaining nurses identified as agnostic or other. The average amount of experience as a nurse was 10.2 years, with 7.4 as a labor and delivery nurse. The first item of the survey was, abortion is important to me. And while there was not a significant increase in agreement with this statement, this was one of the questions with the strongest baseline agreement. The following 2 items did have significantly increased agreement with the statements. Abortion services should be available to any person who requests them, and abortion services should be available at Methodist Hospital after viability. One of the strongest findings of the study in regards to abortion services for non-lethal fetal anomalies. Regardless of trimester, there was a significantly increased agreement with availability of abortion services in this circumstance. Lastly, looking specifically at 3rd trimester abortion services, there was a significantly increased agreement with the availability of services for maternal health conditions and lethal fetal anomalies. Through the survey, we also collected information on what nurses felt were barriers to caring for patients undergoing abortion. Here you can see the top 3 barriers noted by nurses: their personal religious beliefs, 16 nurses, the emotionally challenging nature of abortion care, 16 nurses, and their lack of experience caring for patients seeking abortion care, 10 nurses. Interestingly, the least frequently noted barriers were the fear of judgment or criticism from people at work, 3 nurses, their friends, 2 nurses, and family, 1 nurse. Our data, consistent with that of other studies, showed that the values clarification sessions were associated with increased nursing agreement with the availability of abortion services at Indiana University Health's Methodist Hospital. While our findings add to the scant body of research, the study had its limitations. The study was carried out in 1 hospital with a fairly homogeneous group of participants, so the results may not be generalizable to other populations. Additionally, as the study was voluntary, not all eligible nurses participated, nor did all nurses answer all questions. Lastly, due to unforeseeable circumstances, the planned follow-up survey has been delayed. Fortunately, the research team intends to collect and analyze follow-up data to see if these outcomes persist or change over time. Additionally, these sessions can be completed at other hospitals or even with other members of the healthcare team that interact with and care for these patients, particularly anesthesiologists. As abortion care becomes further restricted by institutional, state, and federal laws, increasing access becomes more vital. Understanding and implementing interventions to reduce abortion stigma and to help healthcare providers clarify their values and align their actions with those values may be one important way to increase access. Thank you all for listening, and thanks for the many people who helped this study become a reality.